It is my privilege to present our work toward the development of a liquid biopsy assay of circulating tumor cells with small cell-like features in patients with metastatic castration-resistant prostate cancer. The increasing availability and earlier use of life-prolonging drugs targeting the androgen receptor signaling axis has resulted in an increase in the frequency of late-stage tumors with small cell neuroendocrine-like features similar to small cell lung cancer. Unfortunately, the pathologic criteria to diagnose the prostate cancer entity are not definitive, and the clinical trial eligibility criteria vary widely in the clinical, histologic, and/or biologic measures applied for entry, limiting our ability to relate outcomes between studies. We hypothesized that an analytically valid assay for a rigorously defined small cell circulating tumor cell phenotype might serve as a unifying biomarker for the presence of neuroendocrine small cell-like tumors in an individual for use in clinical trials. Our strategy was to apply the reported pathologically defined criteria for small cell carcinoma according to the World Health Organization, illustrated on the left, to circulating tumor cells from a prostate cancer patient identified with the Epic Sciences platform on the right. The individual features are detailed here, and again, it was our hypothesis that the features that define small cell carcinoma of the lung could be used to reliably and reproducibly detect neuroendocrine-like small cell-like CTCs for use as a non-invasive real-time diagnostic. One example of the features is illustrated here and relates to chromatin status. Euchromatin, open, active, typical for an adenocarcinoma-like circulating tumor cell. Another with a heterochromatin pattern, dense and inactive. And a third with a salt and pepper pattern seen frequently in small cell lung cancer associated with very high proliferation rates. Overall, we've looked at 5 features, 4 those of the WHO and 1 additional one, which is detailed on the poster. But first we looked at how frequently do we see cell populations that have these features in individual patients. Looking by line of therapy, first, second, and third line, we see that the frequency of the circulating tumor cells isolated with the neuroendocrine-like small cell features increases by line of treatment. We also see that the level of AR expression is lower, typical with the small cell phenotype. Again, recognizing that only 3 of the 5 features defined have been fully analyzed and the work is ongoing, we looked at the changes in the percentage of cells present in patients with CTCs by different classes of drug. And note, the only drug class in which there is a significant reduction relative to baseline is when platinum is used, which is one of the standards to treat small cell carcinoma in the lung, as well as small cell carcinomas phenotypes in prostate cancer patients. So in our ongoing work, we've shown that single circulating tumor cells that are consistent with the WHO pathologic criteria for a neuroendocrine small cell diagnosis can be detected in metastatic castration-resistant prostate cancer patients. We see that the frequencies of CTCs with these features are higher in patients who failed more treatment, and we see specific reductions in the percentage of these cells characterized with 3 of the 5 features under analysis vary by drug class and suggest at this point much higher sensitivity to a platinum-based regimen. And again, it is our goal to develop a rapid, reproducible, and non-invasive method for identifying these cells so that we can have a unifying biomarker in clinical trials.